My name is Dr. Sara Hawatmeh. I'm double board certified in internal medicine and obesity medicine at Illumination Health at St. Luke's de Pere Hospital. I started off in internal medicine, worked for 3 years, and found that a lot of our patients had issues with weight, which was what really drove their diabetes, their high blood pressure, and they were always asking, how can I get off these medications, or how can I better deal with my issues? So that's kind of how I got into obesity medicine. My focus is mostly on primary care and preventative medicine and trying to prevent obesity-related conditions such as diabetes and hypertension and control those to help the patient live their best lifestyle. I have a special interest in diabetes. When I was in residency, we did a quality improvement project on diabetes at our People's Health Center, and that's kind of what sparked my interest in diabetes and weight interests. And we presented at the American Diabetes Association, and when I was starting in practice, I noticed that there was a real need for a holistic approach to patients. And it wasn't just based off of their comorbidities, their health concerns. It was kind of a full patient approach. So, really talking to them about what they struggle with, what their lifestyle is like, and focusing mostly on that and trying to target each one of those problems so that we can get them to live their best life. I've always known that I've wanted to become a doctor. I come from a long line of doctors. I remember weekends were spent with my dad going on rounds to the hospital. It was like the highlight of the weekend. My grandpa had a nickname for me, and it was Doctora, which means doctor in Arabic. So I've always really loved medicine. I've loved the relationship that I've seen my family members have with their patients, especially my dad, who's a primary care physician as well. So it's kind of something that I've always wanted to pursue. Throughout my training, nothing really appealed to me like primary care did. And you could do so much with internal medicine, so that's why I really love what I do. I was able to branch out into the obesity and focus on so many different medical illnesses like diabetes and high blood pressure and weight and mental illness as well. So it's why I do what I do. I love it. Anyone who struggles with weight can come in and we can kind of talk about what your struggles are, what your goals are, and see how we can help you attain that. A lot of my referrals are from primary care physicians or bariatric surgeons, people who don't want to go through weight loss surgery. We try and do our best to manage you medically and see what we can help in regards to lifestyle changes that would keep you from having to go through surgery if that's not something that you're interested in. But we also do, if I think that you are a candidate for bariatric surgery, I will talk to you openly and honestly about that, and that's a conversation I have with my patients. I like to take my time with patients and really understand what their concerns are. So if you come to me for a primary care appointment, we go over your full medical history, your social situation, and try and address any concerns that you have. If you come to see me for obesity or weight management, we do body composition, so we get a better idea of kind of where our targets are. We do a full weight history as well as dietary history and exercise history, and work with you in regards to that. My philosophy is lifestyle management, so something that is going to be maintainable throughout your life. And we really focus on micro goals, so giving you little goals at a time so that you don't really feel overwhelmed trying to make the changes all at once. And we kind of work from there. So it is a lifelong process, and we try and provide you with all the resources that you need: meal plans, dietary guidance, exercise guidance, and point you in the right direction. We are trying to do non-invasive aesthetics and non-invasive aesthetics procedures in the office. So as you lose the weight, we want you to look and feel your best. Patients come in, they've done the hard work of losing weight, but they have their saggy skin, or they're getting older and they, are starting to see those lines on their faces. So I really strive to create an environment in the office with all the resources that you could possibly need. And so that is something that we are working on doing. And a lot of patients who have already done the hard work and have some things that they just aren't really happy with and they don't want to undergo surgery, we can see if we can try and help them with that. St. Luke's does have so many resources like My New Self and Healthy Way, and they do have like the bariatric surgery program. So it's nice because you have it all in one system, and we all have a very good working relationship with each other. Healthy people should see a primary care physician because it's good to establish yourself with someone who will at least know what you are when you're healthy in case anything does happen to go wrong. Plus, we focus a lot on preventative medicine, so trying to keep you from needing a physician emergently or doing your cancer screenings or any type of screening tools and preventative medicine, making sure your blood pressure is okay. A lot of these diseases are silent killers, so you may not feel bad, but your blood pressure may be elevated, or you may be insulin resistant, or you may be pre-diabetic, and you won't really know that until you get to the stage where you really need help. So we try and at least have you come in once a year, see your beautiful faces, get to know you as a person so we can give you the best care possible if and ever you need it. I did my residency training here at St. Luke's, and I was a chief resident my 3rd year, and St. Luke's has just this very special atmosphere. Everyone is very friendly and helpful, and it was something that I definitely missed once I left residency and I was in private practice. And I wanted to expand my practice in regards to weight management and also aesthetics to kind of provide that patient the full package, everything that they need to look their best, feel their best, and be their best. And St. Luke's was the only place that I would consider doing that because it provided me with such great training and such great relationships. So that's why I really wanted to come back here. I think patients choose St. Luke's doctors for the same reason physicians choose coming to St. Luke's. It's just a very friendly, open atmosphere. Relationships with your physicians are very different. I believe you become more personalized, you have more personalized care. Everyone is very willing to help each other. So I think that it's a smaller hospital as well, so it gives you kind of that more intimate, personalized care feeling. So while I speak 3 languages, I speak Arabic, English, and pretty okay at Spanish. I should practice it more often. And if I wasn't in medicine, I'd probably do interior design or event planning.